Okay, so today we're going to learn the basic guidelines for colon cancer screening for step 1, step 2 USMLE boards and in general. So when we're memorizing the colon cancer screening guidelines, there are 3 things that you have to know. Patients at average risk, like the people, normal patient population, patients at high risk. Then we have the patients with ulcerative colitis. Okay, so these are the 3 categories: average risk, high risk, ulcerative colitis. So in average risk patient, the magic number is 45. So whenever the patient turns 45, that's when you will start with the screening for colon cancer. Now, how would you screen? So there are the magic 5 bullets that you have to remember, and based on the degree of invasiveness, from low invasive to highly invasive, I'm going to point them down, also as well as from the most number of screening required to the least number required. Okay, I'll tell you what that means in the end. So first, what we can do is fecal occult blood testing or fecal immunochemical testing annually. Okay, annually means every year. The second we can do is fecal immunotesting, but this time with DNA, and it basically just tests the DNA in these two for malignant cells. And then we have and we do this every 1 to 3 years. Okay, then we have the CT colonography, basically just CT of the colon, and we do this every 5 years. Then we have like getting more invasive, we have the sigmoidoscopy, flexible sigmoidoscopy. Okay, and we do, and it's kind of special, this one. For flexible sigmoidoscopy, you can either do it every 5 years, or if you are doing the fit test. Which fit test? This fit test. If you're doing this fit test, then you can do it every 10 years with fit test. So if you're going for flexible sigmoidoscopy, for example, you do it at age 45, then either the next time you'll do it will be when you will be 50, or you can do it at age 55 if you're getting a fit test every year. So that's very high yield for your boards. And then the final one, the most obvious one, is like the colonoscopy, and we do it every 10 years. So you can see that this is annually 1 to 3 years, 5 years, 5 year, 10 year, 10 year. So least number of year to most number of years, and the least lowest invasive to the maximally invasive. So this was just for patients who are at average risk. For patients who are at high risk, we have two main things that we have to keep in mind. Okay, so for high risk, you can either have a first degree relative like your dad, your mom, an uncle, and all of that stuff, or you could have adenomatous polyps. So these are the 2 things that put you at high risk. Okay, so firstly, for adenomatous polyp, the high risk things that could make, because adenomatous polyps can also be benign, but they could become at a high risk if they are greater than or equal to 10 millimeter, if they have a high grade dysplasia, or if they have villus elements, for example. So all of these things that like mark it as like high risk. Okay, otherwise adenomatous polyps can be benign, can also be found in the general population. Now for first degree relatives like your father, mother, etc. Now for either of these two conditions, what we do is that we start colonoscopy. So none of these tests we will do. We won't do any of these tests, only colonoscopy. And we will do the colonoscopy at age 40. So 40 is the magic number here, at age 40. Or if the high risk factor is the first degree relative, then 10 years before whatever age that relative was diagnosed. So I'm going to explain that with a couple of examples. So if, for example, also the colonoscopy basically starts, we do the colonoscopy like repeated every 5 years after whenever we start. Okay, so like for first example, like for example, I have a parent who was diagnosed with colon cancer at age 50. He is a father. Now when will we start the screening in his child? At age 40, right? Because we do it 10 years prior to whatever age the relative was. So 50 minus 10 is 40. And also the general age at which we start the screening is 40. So that's not a big brainer. And then for after 40 we will repeat the screening like at 45, then at 50, then at 55, and etc. Now what if the parent was, say, 40 when he was diagnosed with colon cancer? Now when will we do the colon cancer screening in his child? Will it be at 40 or will it be at 30? It will be at 30 because we do it 10 years prior to whatever age the relative was, or we do it at 40, like depending on whatever is closest to the age of the patient. So we will do it at 30 because 40 minus 10 is 30, right? And then we will do it every 35 years, and then 40 years, and then 45, etc. Now what if the patient was, say, 55? Then we will do it at 40 or 45. 40, because 40 is closest to the age. We just want to be cautious in this case. Whatever is the closest to the age of the kid, we will go for that. So 45 is further away than 40. That even though 55 minus 10 is 45, we'll go to 40 because 40 is closest to the age of the patient, earliest that we could do the colonoscopy. And then we will do it at 45, and then 50, and then 55. Now what if the patient was 65? What will we do then? Well, then we have two options: 40 or at like 55. So obviously we do it with 40, like the previous rule, that it is closest that we can do the colonoscopy. So we will start it at 40. But here is a rule that if you have a first degree relative and his age is greater than 60, then we do the screening repeated screening. Okay, not the first screening, the repeated screening after every 10 years. So here we will doing it after 5, then 5, then 5, then 5. But here we will do the screening like after 50, and then plus 10, 60, and then plus 10, 70. And like just like that, for example, if the patient was 75 or 70-year-old, then we will start the screening at 40. And how will the repeating schedule go? 50, 60, 70, and so on. Because greater than 60, we repeat the screening every 10 years, not 5 years. Because the logic behind that is, after 65, it's simply not as much of a hazardous thing that you have to screen every 5 years. Like, you can do it at 10 years and that will be completely fine. Okay, so that is that. And now the last case is with ulcerative colitis. Relatively straightforward. 8 to 10 years after the diagnosis of ulcerative colitis, you can do the screening colonoscopy, and then repeat that colonoscopy every 1 to 3 years. So 8 to 10 years and then 1 to 3 year repeat. Okay, so that is basically the colon cancer screening guidelines, and I hope you guys understood everything. If you have any issues or if any confusions, you can write that down in the comment section. I'm always here to listen to it. And yeah, subscribe and like, and I hope you enjoyed it. Thank you.